Is finding your dream career feeling impossible right now? You're not alone. Welcome to Career Blueprint, the podcast that helps you figure out your next career move. We explore the trends in tech shaking up the job market, giving you the unfiltered advice you need, whether you're starting out, changing direction, or guiding someone else. Let's figure out what's next for you together. This is Career Blueprint. When was the last time you went to the doctor's office? Chances are it's been a while. It's usually an experience most of us try to avoid. If it's been some time since your last visit, you might be surprised next time you go. Something has changed in the exam room. Imagine you're there now. You're sitting in an exam room with your doctor making some small talk, asking how your day was. You're wearing one of those flimsy paper gowns, and you're trying to gear yourself up to share something embarrassing. You haven't exercised, you're feeling depressed, you've gained weight, something hurts, all your secret worries. But this time, there's no sound of frantic typing coming from your doctor while she looks at her computer screen. You're just having a real conversation with her. What if I told you that in that moment, artificial intelligence is quietly listening to your conversation? Not to invade your privacy, but to help your doctor focus entirely on you. Sound scary? Welcome to the world of ambient listening AI. One way that artificial intelligence is quickly changing the way medicine is practiced today. I'm CareyOConnor, and this is Career Blueprint, where we make sense of work's shifting landscape and help you understand how those changes may impact you and your career. So, what exactly is ambient listening AI software, and why is it suddenly showing up in exam rooms? Let's talk about the technology. Ambient listening devices aren't new. The concept and rudimentary technology have been around for over 100 years, but you know it under different names. Think about CDs, cassette tapes, 8-tracks, the dictaphones we used in the 80s and 90s. All of these technologies trace back to the phonograph, which was invented in 1877. So the idea of recording someone speaking or making a sound is not new. It's been around for a long time, and most of us are pretty comfortable with the technology. What's different, what's new, is how AI is being used with recording devices to filter, synthesize, and even organize what is being said and recorded in real time, so only the most clinically relevant information remains. And that information is organized in a neat summary report that your doctor or clinician could upload to your patient file with just a touch of a button. That's a real game changer. So, how does the software work? How does a doctor use this technology, and what happens when they do? Do they need some kind of special equipment? A doctor or clinician will use a discrete microphone or smart device during the exam that is connected to the AI software. Frequently, it will just be an app on their mobile phone. He or she will place the device in the exam room and start the appointment as usual. The recording device will then record the entire conversation between the doctor and her patient without interrupting the natural flow of the interaction. While the device is recording, it is simultaneously transmitting the audio recording to AI software in the cloud. The software uses advanced speech recognition and natural language processing algorithms to simultaneously convert the dialogue into text. There's no lag time. It happens real time. Now, so far, this process is using technology that's been around for a while, and technology most of us have used. Natural language processing is what's behind Siri, Alexa, and chatbots. So every time you ask Siri or Alexa to do something, you are helping train an algorithm on natural speech patterns. What's new is how engineers have programmed the software to identify and filter complex medical conversations. This software can recognize medical jargon and understand the context in which words are used. It can highlight symptoms paired with severity descriptors, things like severe chest pain radiating down my arm, or bad cough that keeps me up at night. It can flag time-sensitive details that are important for a diagnosis, things like the pain started around 3 days ago. And it prioritizes content containing medical terms, things like symptoms, diagnosis, medications and treatment plans, and medical action verbs like prescribed, refer, schedule. The software also identifies and filters out irrelevant content like small talk, things like how was your day, and more importantly for many of us who worry about privacy, it can filter out non-medical details that you may not want recorded in your permanent patient file. The software can be customizable with rule engines to carefully edit sensitive topics like mental health or substance abuse, leaving only the most important, clinically relevant parts. It can even cross-reference previous entries in your electronic health record to help you flag any potential anomalies. Once the software has identified and extracted the clinical details from your conversation with your doctor, it organizes them into structured, readable notes. The final product is not a transcript of your conversation word for word. It's a summary of only the most clinically relevant part of the conversation, and it's organized in a format your doctor commonly uses, like progress notes, order entries for labs, prescriptions. So doctors don't have to waste time copying and pasting the summary into a different screen. It's right there, in the right place, and written the right way. The final step is a review of the summary by your doctor or somebody in his or her practice to check for errors before it is saved in your electronic health record. Then the recording of your conversation is deleted. It's gone forever. Once the summary is saved in your electronic health record, the system will then assign medical coding to your visit and route details regarding your visit to your insurance company for reimbursement. Medical coding is how insurance companies determine what medical services were provided to a patient and how much to reimburse healthcare providers for those services. This is a huge time savings for your doctor. You can see why ambient listening AI software is gaining traction in healthcare very quickly. Around 30% of physician practices in the U.S. currently use ambient listening AI technology, and over 3,000 hospital systems have adopted it. It is one of the fastest growing AI applications in healthcare. Different versions of the technology are made by several companies, including Ambient Healthcare, Abridge, Suki AI, Nuance DAX, OnPoint Healthcare Partners, Nabla. So if you haven't encountered it yet at your doctor's office, keep your eyes open. It's coming. I recently experienced the software myself during my annual exam with my physician. After I was shown to my exam room, I noticed a super small discreet sign on the back of the exam room door warning patients that my doctor may be using an ambient listening device. Honestly, I was a bit freaked out. I don't want my cholesterol levels, my weight, my medical history floating around on the internet. So when my doctor came in my exam room, I immediately started to grill her about the technology. She very patiently answered my questions. And after my questions just kept coming, she offered to run an experiment with me to let me say whatever I want during the exam to test the software, and then she would let me see what the final report looked like at the end. I liked this because I'm definitely a trust but verify kind of person. So I put my privacy concerns aside, and we proceeded with the visit using the listening device. We talked about normal stuff, but I also planted a few choice comments about my health insurance and the state of the world, and I expressed my concerns about the software itself and how technology is taking over everything. At the end of the visit, she immediately turned her computer to me and invited me to read the notes the software had recorded simultaneously while we were speaking. I was shocked, truly shocked. I expected a word-for-word recitation of what I said with some errors that needed correction, something similar to using the dictation feature on your phone. But what I saw was different. It was better. The report was a neat, short summary of the medical issues we discussed. It didn't include my doctor's questions, my comments regarding my health insurance or the state of the world or the software. None of that was reflected. Instead, it was a clinical summary of what I had said about my physical and mental health. The report used full sentences. It didn't have any punctuation errors. More importantly, it was accurate, 100% accurate. It looked exactly like I would have expected my doctor to have typed herself. So you can see how ambient AI listening software is a game changer in medicine, where documentation is a constant challenge. This leads me to think, as this technology is adopted and improved, how is it going to change jobs in the healthcare industry? We've all heard that AI is coming for our jobs and that robots will soon replace us. But the reality is much more nuanced. So let's take a look at a couple of jobs and think about how might the software affect them. The most obvious place to start is with physicians themselves. And the short answer is that most physicians are going to love this technology. You may not know this, but we have a significant shortage of physicians right now. The Association of American Medical Colleges estimates that the U.S. needs at least 34,000 more physicians right now to adequately address demand for medical services. And they are projecting that the shortage will dramatically grow over the next 10 years to as many as 86,000 more physicians needed as our population ages. With baby boomers retiring and aging, the demand for medical services is expected to grow and peak in the next 10 to 20 years. So we need more physicians, not less. This is particularly true for primary care physicians and all types of doctors in rural areas. Making this worse, waves of physicians are retiring early because of burnout. Almost 50% of physicians today report feeling burnout and are thinking about quitting. That's not good for any of us given our current shortage. One of the primary drivers for physicians' job dissatisfaction is administrative burdens, particularly documentation requirements. Most physicians enter the field of medicine because they want to help people. They want to connect with their patients, understand what is going on, and help them feel better. They didn't go through 11 years or more of education after high school so they could type on a computer. Freeing physicians from the computer screen helps them connect with their patients, which drives their job satisfaction. And frankly, it's better for patients as well. So ambient listening AI technology is a win for most physicians. It is likely to augment and improve their job, not replace them. What about other medical professionals like nurses, physician's assistants, and other clinicians? The impact on their jobs will be similar. Like doctors, a significant part of their workload is documenting their work and findings. Nurses spend around 15 to 20% of their time on patient documentation. This technology will lighten that administrative load and will be a net positive for nurses. And like doctors, we've been experiencing nursing shortages for years, and professional burnout is high. So what about other jobs in healthcare? How will the software impact administrative jobs within the medical field, particularly people who work in medical records? That's the area where a lot of our medical jobs are focused. I'm talking about the army of people, usually women, who work behind the scenes in every doctor's office, hospital, and clinical setting to help patient records stay accurate. They help offices comply with regulatory requirements. They move records between doctors' offices, hospitals, and other clinical settings, and they help process insurance payments. How is ambient listening AI software going to affect their jobs? The short answer is that there will be some negative, but also some positive impacts. So what are these jobs that we're talking about? People in this field may have job titles like medical records clerks or technicians or specialists or medical records analysts or health information clerks or technicians or specialists. The job titles may be slightly different, but the general job duty of these persons is to create, update, maintain, and transfer patient records for clinical purposes, for insurance, for billing, and for regulatory compliance. And this group of jobs, medical records, is where the software is going to have the biggest impact. Before we talk about what the potential impact on these jobs may be, let's quickly discuss why is this important? Why are we even talking about this? There are two primary reasons. First, these are decent jobs. Working in medical records usually does not require a college degree or much education after high school, but the jobs have decent pay. The median annual wage in the U.S. for medical records specialists is a little over $50,000 a year, or $24 an hour, and wages go up with experience and responsibility. That's not bad for a job with minimal education or job training requirements. And these jobs usually come with health insurance benefits and are located in a comfortable office environment with predictable 8 to 5 hours. So again, these are decent jobs. Second, it's important to talk about this because a lot of people work in medical records. Conservative estimates indicate that there are at least 400,000 people employed in maintaining medical records in the U.S. That's a lot of people. For perspective, that's about the same number of people who live in Lexington, Kentucky, Honolulu, Hawaii, Cincinnati, Ohio, St. Louis, Missouri, Corpus Christi, Texas. So it's important to think about how this technology will impact those people and their jobs. Will it replace everyone as some predict? As I mentioned before, the answer is much more nuanced than when we were talking about doctors and nurses. Frankly, some of these jobs in this field will go away. The software is going to greatly reduce jobs in this field that focus on entering or uploading patient information into an electronic health record or system. Put another way, the data entry work. We'll see this first with jobs with the job title medical record scribe or transcriptionist. People in these jobs accompany physicians during patient visits, and they document the patient's history, physical exam findings, procedures, lab, and imaging results, and other relevant information directly into a patient's electronic health record. Sounds familiar, doesn't it? Ambient listening AI software is designed to replace those jobs. So jobs involving clerical and data entry in medical records will be negatively impacted. Long term, that's not a good field to be in because over time, AI is going to be used to import and structure key information in patient records automatically. We just won't need as much human intervention as we do now. But that is not all the jobs in medical records. What about medical records coders? Coders are people who convert the information in a patient's health record into standard medical codes for billing, insurance, and regulatory purposes. This matching of a diagnosis to a universal health insurance code is exactly the type of work in which AI excels. AI software is very good at suggesting and assigning medical codes for straightforward cases. Now, we all know not all medical issues are straightforward. So for now, medical records coders are still needed to correct AI errors, address complex medical cases, and audit records. But over time, over the next 3, 5, 7 years, we're going to need less people working in medical coding. So is AI going to take all jobs in medical records? No, it won't. With ambient listening AI software, the initial data entry will be automated, which will reduce manual data entry requirements, but we still will need people overseeing the data and correcting and validating what is in a patient's record, especially as we're all developing our understanding of this technology and building trust that it works the way we're being told it does. AI systems, while powerful, sometimes misinterpret conversation context or medical jargon. It makes mistakes. And the AI systems struggle with complex cases involving multiple medical issues. AI systems do best with predictable, routine matters. And as we just discussed, healthcare is not always routine or predictable. So we will still need humans to identify and correct mistakes and anomalies in a patient's record. So which jobs in medical records will remain as AI is adopted? Look for jobs with job titles like Data Quality Analyst, Health Information Analyst, Medical Records Auditor, Clinical Documentation Specialist, Health Technology Integrator. If you work in medical records or are thinking about a job in the field, what do? First, don't panic. AI is being used in different ways in healthcare, but adoption is slower than in many industries. Medical records can contain highly sensitive information. People will be very slow to trust the technology. Also, most medical businesses are small offices with 10 to 20 employees. They don't have a huge IT team who can implement new technology. So adoption of AI tools will take a while. Second, learn about the technology and how it's being used. Be curious, lean into it. Be open to learning something new and changing how you do your job. If you can, learn how ambient listening AI software works and be the person in the office that others go to for questions. Try to participate in the testing, training, and integration of these systems into your office. Be the bridge between clinical teams, IT, and compliance departments. You want to be training others on how to use the software, not the person who's afraid of it. Third, think about what tasks you do every day and how they might be automated. Are you typing information into a computer or cutting and pasting information from one computer system to another? If so, your work may be automated in the next couple of years. You want to be doing a job that involves things like quality control, ensuring patient privacy, data oversight, or auditing to make sure records are accurate. For now, AI software needs human oversight and monitoring. You want to be the person who can do that work. Thank you for joining me today on Career Blueprint. If you have a minute, I would love to hear what you think. Please leave a comment, a question, or a review and follow me on social media. And I'll see you next time when we talk about another AI technology and how it's changing the way we work.